Hello, everybody. My name is Rosa Echeverria, and today's topic will be heroin. Heroin is an opioid drug that is made from morphine, which is a substance from the seed pod of the opium poppy plant. Heroin is grown in Southeast and Southwest Asia, Mexico, and Colombia. It often comes in white or brown powder. The white powder is pure heroin and it can be snorted or smoked. This type of heroin is more appealing to users because it eliminates stigma with injection use. Black tar heroin, which is the brown powder, is sticky and is predominantly produced in Mexico. It has a dark color because of the crude processing methods that is used to make that kind of heroin. This type of heroin is impure and is usually dissolved, diluted, and injected into the vein muscles or just under the skin. The common names of heroin is horse, Helda, smack, and big H. Heroin is illegal and it is also highly addicting. According to the book, heroin is classified as a Schedule I drug by the DEA. It is not approved by any clinical use in the United States, and 600,000 to 1 million addicts live in the United States, and that number has remained stable. According to the book, hardcore addicts share a common place called shooting galleries, which can be in homes or even in abandoned cars. Heroin can be used in many different ways, such as injections, sniffing/snorting, smoking, and also mixing with crack cocaine. So heroin enters the brain rapidly and binds to opioid receptors on cells located in many areas, especially those involved in the feelings of pain, pleasure, and in controlling heart rate, sleeping, and breathing. Short-term effects of heroin include dry mouth, blushing of skin, heavy feeling in arms and legs, nausea and vomiting, and itching. Long-term use of heroin effects include insomnia, collapsed veins for those who inject, damaged tissues in the nose for those who sniff or snort, infection of heart lining and valves, liver and kidney disease, and in men, sexual dysfunction, and for women, irregular menstrual cycles. As someone continues to use heroin, physical dependence is likely to happen. Tolerance and withdrawal are the body's responses. The body adapts to the drug in order to promote survival, but the body can combat that survival through tolerance. Research shows that heroin abuse causes deterioration of white matter in the brain that affects decision-making capabilities. It also loses ability to control behavior and methods of responding to stress. People choose heroin because it relieves pain, but it also makes people feel relaxed, peaceful, and drowsy. The short-term relief from anxiety, stress, or depression. Other opiates do the same in terms of relief from anxiety, stress, or depression, but heroin is much cheaper. People take heroin also in dangerous ways so that the higher doses of drug reaches the brain quicker. The symptoms of overdose of heroin include dry mouth, small pupils, blue nails, skin or lips, and coma. It is hard to tell if someone is overdosing on heroin because many of the symptoms of overdose are the signs of common use of heroin. You can tell if someone has an overdose if they pass out quicker than usual and if they have shallow breathing. A person who is overdosing on heroin also doesn't respond to pain cues. Those who have survived overdose of heroin still experience high health complications such as kidney failures, heart problems, and fluid in lungs. Naloxone is often used to counter the effects of opioid overdose. Now I'll be talking about heroin in college students. Most colleges actually just focus on substance use prevention on alcohol, marijuana, and prescription drugs. National surveys indicates that fewer than 1% of students use heroin. Although it is less likely to be used by college students, it is still dangerous because it is highly addictive. United States heroin use. According to the CDC, in 2018, 15,000 people died from a drug overdose that involves heroin. 5 deaths for every 100,000 Americans is a result to heroin. In 2018, heroin-involved overdose has declined 4% from 2017 through 2018. Opioid addiction has reached epidemic proportions in the United States because it threatens public health and national security. It all started with the overprescription of pain meds. The government has responded by limiting the number of prescriptions in the US and also providing counter-narcotics assistance to Mexico and China. People are now using synthetic opioids more because they are cheaper and more potent than heroin. According to the CDC, heroin and fentanyl are most used often in combination with other drugs such as alcohol. Thank you everyone for listening.